Right. So, hello and welcome to the last in our series of COVID-19 media briefings, which coincides with the lifting of COVID restrictions this week. This briefing is being hosted by Nottingham City Council, Nottinghamshire County Council and the NHS, and it's Friday the 25th of February. In this briefing, we'll give you an update from each of the three organisations, and then we'll throw it open to questions from the media. On the panel, we have Lucy Hubber, Director of Public Health in Nottingham, Jonathan Gribbin, Director of Public Health in Nottinghamshire, and Amanda Sullivan, Accountable Officer for the NHS across both Nottingham and Nottinghamshire. After their updates, if you'd like to ask a question, please raise your hand and we'll come to you one at a time. And please also remain on mute with your cameras off until it's your turn to ask a question. And for the purpose of the recording, it's really helpful when you ask a question if you could identify yourself and which media you represent. Thank you. So to get us underway, I'll hand over first to Jonathan Gribbin.
Thank you, Steve, and good morning, everyone. I'm going to cover something on the big picture. I'll brief you on the local situation, and then I'll turn to living with COVID and its implications for us in Nottinghamshire. So if we think about the big picture for a moment, we're now 2 years into a pandemic. If we look at some of what the World Health Organization or SAGE envisage as likely possible scenarios for the period ahead, in most cases, those organizations are identifying that it's likely to be several more years before we reach a situation of stability and predictability. So I think we can characterize the current situation as one where we're reaching a significant milestone, but not yet the final destination. We're perhaps at half time, but the match is certainly not over yet. And I think that situation is reflected very much in what we see locally as well. Because I think we can look around and see that the very worst of the winter pressures are perhaps now properly behind us, but there are still plenty of pressures around in our health and social care system. There are still hundreds of people across Nottinghamshire who are testing positive for a disease which for some people still remains extremely serious. And it's really into this context that the Prime Minister made his announcement about living with COVID earlier this week. And living with COVID as a plan represents an evolution of a strategy from one that relies on breaking the chains of transmission with a move towards protecting those who are most at risk. It involves a change of approach, so moving away from testing and tracing and a reliance on that towards an increased emphasis on promoting safe behaviours. And it also involves, for some people at least, a release from legislation and enforcement to an increased emphasis on exercising personal responsibility. So practically speaking, what does that mean for us? And how can we, as we move into this next phase of the pandemic, be sure to keep ourselves safe? Well, first of all, it's by getting vaccinated. And I want to remind people across Nottinghamshire that if you're over 16, you can still get your first or second dose, or indeed your booster. And if you're not sure how to do that, if you put into a browser Nottinghamshire COVID vaccination, that will come up with information from our local NHS colleagues, which will point you to how you can access a vaccine still. Practicing safer behaviours also means that if we're meeting or working with others indoors, we should be sure to let plenty of fresh air in, or better still, as we see warmer, lighter weather and days approaching, we can meet up outdoors. It's really important to consider as well wearing a face covering in crowded and enclosed spaces, and especially if we're coming into contact with people that we don't normally meet up with. Also, it's important that we continue to take a test if we have COVID symptoms, and that we stay at home and avoid contact with other people if we test positive. Also, safer behaviours involves washing our hands, and if we are sneezing or coughing, it's important that we follow that advice to catch it, bin it, and kill it. And then finally, as part of our safe behaviours, I also want to emphasise how important it is that we try and stay at home if we're unwell. And I think for many of us, this is going to involve a shift of behaviours as we move into the future. Because in the past, you might be someone perhaps like me who would have chosen to struggle to get into work if you'd had a cough. Well, I think in the future, it's going to be really important that for ourselves and for those around us, for our workplaces and our schools and the other environments in which we mix with other people, that we stay at home if we're feeling unwell at all with something like a cough. So as we move into this next stage of the pandemic, what I'm wanting to emphasise is that COVID remains a really serious disease for many people. And so it's absolutely essential that we remind ourselves and continue to focus on these safer behaviours. Thank you.
Thank you, Jonathan. Could we move next to Lucy Hubbard from Nottingham City Council, please?
Hi, good morning, everyone. I think I'd like to start by recognising that we're at the end of the beginning. We've done the last 2 years have been really tough, and for many of us we've had to make significant sacrifices. And I want to thank everybody involved. I want to thank our communities for the response that they have shown in following all the guidance and doing everything that's been asked of them. I want to thank the frontline workers, whether it's social care workers or healthcare workers. And I want to thank those people who've been working tirelessly in public health, both within the local teams, but also in those regional teams and national teams that have provided us with all the information, provided us with the support, and enabled us to create the safe environment. As we've heard, COVID isn't over. We've got at least 4 or 5 years ahead of us as we learn more about COVID and we learn to live safely with COVID. We've currently got still significant numbers of cases within our community and still seeing people being admitted to hospital because COVID remains a serious illness for some people. Very sadly, we're still seeing people die from COVID. So COVID isn't over and COVID isn't mild, but we have made huge progress. And one of the most important things is vaccination. And we've really seen the difference that vaccination has made to our communities. So one of the most important things that we can do is continue to get vaccinated. Come forward and have your first or second dose if you haven't yet. And if you're offered a booster, please come and get boosted. What we know about Omicron is that it's much milder. It's much less likely to be severe if you've had those repeated doses of vaccination. Vaccination works, and vaccination is much safer than risking having COVID. The next thing to think about are the things that we can do to make us all feel safe as we go forward. Some people are really, really looking forward to getting back to as close to normal as possible. And other people are still feeling very anxious, either about their personal risk or risk to loved ones. And we have to respect that people are going to be moving at different paces now. Some people are desperate to get back to normal, and some people want to take a steadier approach. And it's important that we respect that so that we move forward together and with respect. There are things that we can do that will make a difference, and ventilation being one of them, making sure that there's good airflow or that we're meeting outside, getting tested if you've got symptoms, and staying at home if you can while you feel poorly. We used to all struggle on and go into work when we had colds, and I think COVID has taught us how important it is and what a difference it can make by staying at home until you feel better, if you possibly can. Getting tested remains important, and then staying at home when you've tested positive. And then there's just some good practice that we've had for a while and that we've seen has really worked. Wearing face coverings and washing your hands and throwing away your tissues, washing your hands after you've blown your nose. They're little things that we can all build into our normal lives that make a difference for us. I think that's the key things I wanted to say today, Steve.
Thank you, Lucy. And can we move on finally to Amanda?
Thank you, Steve. Yeah, morning, everyone. So you've heard COVID is still very much in our communities and still very much in our hospitals. The numbers of people in hospital with COVID are coming down slowly. So we saw 114 admissions in the week up to the 20th of February, compared to 138 the previous week. And we had 306 people in beds in hospital with COVID on the 22nd of February, compared to 303 the prior week. But the overall direction is slowly reducing in hospitals. And we had 3 people who were so seriously ill with COVID that they needed to be on a ventilator. And that is obviously the most critical condition that you can be in. But mercifully, this is the lowest number that we've seen since the beginning of the pandemic. We did have 12 deaths, very sadly, in the week up to the 23rd of February, compared to 10 the previous week. So you can see that COVID is still very evident in the NHS. And earlier this week, the Prime Minister outlined the plan for living with COVID, including removal of restrictions in the community. However, in the NHS settings, there is no plans to change our protected measures at this stage. So if you go to your GP or to a hospital appointment, you will be asked still to wear a face covering when you're in any healthcare setting. So vaccine does remain our best defence, and there is still plenty of availability for your first, your second, or your booster jab. Do get topped up if you are eligible to do so. And over the last 14 months, we've delivered an incredible 2 million COVID vaccines across our area, Nottingham and Nottinghamshire. And as a result of this huge effort across the whole country, the Health Security Agency for the UK has got data now which shows more than 100,000 hospitalisations have been avoided. So 100,000 people have not needed to go to hospital with serious illness from COVID when otherwise they would have had to. So that's really good news from the vaccine campaign. And we are planning a further spring campaign for vaccinations, and we'll also deliver an autumn campaign if that is recommended by the Joint Committee for Vaccinations and Immunisations. So our spring campaign that we are currently planning includes further boosters for anyone over 75 years of age, residents in a care home for older adults, and anybody over 12 who's immune suppressed for any reason. And for that, we are also going to be vaccinating 5 to 11-year-olds as well. We are vaccinating 5 to 11-year-olds at risk at the moment, but in the coming weeks, we anticipate moving to offer that choice to parents of all 5 to 11-year-olds. So we're working on plans to make our facilities as child friendly as they possibly can be. And we still are very much encouraging 12 to 15-year-olds and any other young people particularly to come forward for your jabs. And we're still continuing to administer our boosters, and so please do come along. If you want to come along and have a chat and you're not sure about your booster, that is still available for you, and we are still doing our local community outreach as well. So you may see pop-up vaccine facilities that appear in your area. Do go along and take up the offer for a jab. Thank you. That's the end of my update. Thank you.
Thank you, Amanda. We'll throw it open to questions from the media now. So do just raise your hand and I'll come to you one at a time. And team shows me the order. And as always, first hand, Hugh Caswell.
Not quite as always, come on. Good morning, everyone. Well, I'll put this to the whole panel, actually, anyone who wants to have a go at answering. With the lifting of the legal duty to self-isolate, I think we can safely say there will be people who know, or at the very least suspect, they have coronavirus, and they have a choice to make about whether they stay home or not. They may have plans, for example, that they're faced with a bit of a dilemma. So what would you each say to people who are in that position?
Thanks, Hugh. Who would like to go first? Jonathan?
I'll have a go. And yeah, good morning, Hugh. And thank you for the question. So the changes that have come in with living with COVID provide some what many of us will feel to be a freedom from a legal requirement and an obligation that's backed up with potential enforcement. And I'd want to urge people in Nottinghamshire to continue to use the freedoms they have to take care of themselves and those around them. And one of the ways that we can do that, if we are unwell, is to try and stay at home, because that's a really good way of protecting those around us. Thanks.
For me, there is absolutely no dilemma, Hugh. If somebody feels they've got symptoms, they should get tested, and if they test positive, they should stay at home. If you don't feel great, I would recommend that people think about the importance of their plans and make a judgment, but preferably always have a test. If you don't feel great and you think it might be COVID, please have a test. The tests are still freely available. We've still got rapid tests available in our libraries, in our pharmacies, and you can still order them online. The PCR testing centres are still open. It's still really easy to get a test and get those results very, very quickly to help you make your decision about what you do next.
Thank you, Lucy and Jonathan. Really important points. Hugh,
Steve, I should just
come back in.
Well, yeah, just to acknowledge that I don't think I listened to the question properly, because actually Lucy very helpfully clarified the case if someone has symptoms. So yeah, that needs to be brought out. Thanks.
Thanks, Jonathan. Hugh, did you have a follow-up question?
Please, yeah, particularly given that you've each emphasised there the importance of testing today, as you have before. But of course, from April the 1st, free universal testing comes to an end. So what impacts do you envisage that having on all of those metrics we often talk about here on case rates, on hospitalisations, etc.?
Clearly, the changing in testing, Hugh, is going to change our ability to report as we have been reporting. So you won't see the same figures that we've been reporting for a while, and we'll really be using a number of surveillance systems, including presentation at hospital, in terms of looking at what's going on in our communities. So it'll be a very different picture, but we can see that case rates are going down, and that these extra 6 weeks, 5 or 6 weeks until testing stops, give us a real chance for making sure that we can continue to try and reduce the amount of transmission as much as we possibly can as we move into hopefully the warmer weather of the summer, and people's ability to get out and about more, which also helps with reducing transmission.
Thank you, Lucy. Jonathan, did you want to come in on that?
Yeah, just to add, yeah, I mean, Hugh, you framed it in terms of free universal testing, just to make clear that we'll be working hard with our regional and national colleagues to ensure that people who are most at risk are still able to access testing that's appropriate to the settings in which they find themselves. So that probably sits alongside your question, which was around free universal testing. Thanks.
Thank you, Jonathan. Thank you, Lucy. Hugh, thank you for the question. The next hand I can see up is Joe Locker.
Hi there, guys. Good to see you all again. So I can definitely echo the fact COVID isn't over, because last week I finally tested positive for the first time in 2 weeks. So that was in 2 years, sorry. And let's just say I'm glad I was vaccinated and boosted, because it wasn't very nice, but I'm better now. So, and that leads me on, I suppose, to, it kind of follows on from Hugh's question really about testing and you know, the fact it's going to cost. And obviously Nottingham and a lot of areas of Nottinghamshire are, you know, do struggle and are going to struggle with the cost of living, petrol prices, all sorts of additional costs. And obviously at the end of March, we're then going to see changes to sick pay. So I guess it then comes down, I suppose, to what Hugh said before in terms of that dilemma of, can I afford to, you know, isolate if I'm not going to get paid? So I suppose, without delving too much into the politics, what would you say to these people? Cheers.
Thanks, Joe. Lucy, Jonathan?
You go first, Lucy.
You unmuted, so I assumed you were going to. Yeah, Joe, I think it's a really critical issue. And we've been very conscious that all the way through COVID, many of the actions we've taken have been harder for people to follow if they have less money or if their jobs are less secure. And you know, this is absolutely one of those occasions where if we're asking people to either lose out by not going to work or to participate in buying tests, then it's bound to hit some people harder than others. We absolutely want to make sure that those communities or people working in high risk settings are still able to gain access to testing, and it's one of those areas that in the Living with COVID guidance received so far, we're just waiting for some more detail, but really committed to trying to make sure that we can protect the most vulnerable in our communities, in terms of living safely with COVID. Very difficult for people, and I think people have to make an individual risk assessment. And the thing I think I'd ask people to think about is around, will they be exposing somebody to COVID who would really, really struggle with it? So there are some workplaces where it will be really important that we make sure that testing and self-isolation are still followed, particularly those around health and social care settings, for example. But it does now come down to people's individual choice, and we will try and make that choice as easy as possible within the bounds of what we're able to support.
Thank you, Lucy. Jonathan, did you want to add anything?
To come in on the back of that, to expand it out very, very slightly onto a more general point that you're really picking up, Joe, which is that you're flagging up a potential vulnerability there, which arises in connection with all kinds of illness that people might experience. And I think the need for us as a nation to recalibrate and support people differently in workplaces when they are unwell. This applies not just to coronavirus and to the testing of it, but actually to how we think about supporting people who are unwell to stay away from work. And you're right to highlight that plays out very differently for different people, depending on what kind of support they get at the moment. And just to come back to the point that's been made earlier on, I think in adjusting our behaviours as we move into this next phase of the pandemic, we do need to be very aware that different ones of us will find ourselves living with different degrees of risk and with different levels of appetite for how we manage that risk as well. So I think it's really important that we're understanding of one another and of those differences, and that we're respectful and courteous, and that as far as possible, whatever new freedom we find that we do have, that we use that in a way that protects those around us as well as looking after ourselves. Joe, finally, I'll just say thank you for having your vaccine, and I'm really pleased that although you got infected, that you haven't been too ill with it. Thanks.
Thanks, Jonathan. Joe, did you have a follow-up question?
No, that's everything from me. Thanks very much.
Brilliant. Thanks, Joe. Glad you're feeling better.
Cheers.
And Joe, thanks for tweeting about how you felt as well. I think it was really important, some of those messages that you put out about the importance of vaccination and how poorly you felt as well. So thank you for sharing your experience.
Thanks, Joe. Next hand is Anna Whitaker. Anna?
Hi, yes, thanks for having me. So my first question is around the number of staff in hospitals who are still unvaccinated. I don't know if you've got those figures, and if you have, I was wondering if there's still a push to get staff vaccinated despite the mandate not being there anymore. Thank you.
Thank you.
Anna, sorry, just to confirm, are you from Notts TV? And
oh yeah, sorry, it's local democracy reporter,
local
Notts
democracy.
TV.
Thank you, Anna. Sorry, Anna.
Yeah, hi Anna. So I don't have the exact figures, but the vast majority of staff who work in healthcare settings are vaccinated, and the drive that we had earlier this year to get as many people vaccinated as possible, we are continuing to do that. So on a very individual basis, we're finding that quite often, if you have individual conversations, listen to the individual concerns of that member of staff, it can take, quite a detailed conversation just to understand fully people's concerns or circumstances. But we are very much still offering that to people, and it still is very much active, sort of work that's underway. There is obviously the consultation on whether or not those plans around making it compulsory should continue or be stopped as well. But also the professional bodies for healthcare workers as well are also very much, I think, thinking that is to be very strongly encouraged. So we are still working along the lines of working with people who are not yet vaccinated to try and address their concerns where possible. So it's still very much active work for us. Thank you.
Thank you. Thank you, Amanda. Anna, did you have a follow-up question?
I do, yes. It kind of touches on what Joe and Hugh have mentioned about testing. I don't know if you have the answer to this, but will community testing be continuing despite the fact that tests will no longer be free, obviously for those people that we've mentioned earlier who won't be able to afford or won't kind of prioritise paying up to £6 for a box of tests?
Thank you, Anna.
We're still waiting for the details, Anna, but our anticipation is that we will be stepping back from community testing when the ability to provide universal free testing ends from the 1st of April. So we'll be no longer providing the community testing or distributing boxes to places like libraries after the 1st of April. What I would remind people is that free tests are still available to be picked up from libraries, from pharmacies, or ordered online. You can order a box once every 3 days online, and those are now, there's lots of stocks, and people can take advantage of the situation now to make sure that they're testing through this period.
Thank you, Lucy. That's a really important point about picking up the test now. Jonathan, did that cover? Are you happy? Great. Thank you. Great. Thank you for the questions, Anna. The next hand I can see, no problem. Next question, hand I can see is George Hancorn.
Hello, everyone. George from ITV Central. Just want to say, obviously, thanks for having us. Good to see you all again. Can I just ask, we're recording this for our bulletin this evening, so when you are answering, are you happy just to pin yourself to your full screen? We're doing it here, but I just want to make sure we've got you full frame. if that's
I'll take care of that, George. Don't worry. I'll spotlight for you.
Perfect. That's amazing. Thanks very much. Probably a broader question for you all, really. But in terms of the last couple of years, and it does seem like it's been a long couple of years. In terms of your approach across Nottingham and Nottinghamshire, what's the biggest sort of lesson that you'd say you've learned? And is there something that, looking back, if we were to come across a situation like this again, you think actually this is something we need to focus our attention on more, or perhaps something we would do differently?
Thank you, George. Who would like to go first with that one? And I'll spotlight you.
I'm happy to go first, Steve.
Okay, bear with me and I will spotlight you for George's benefit. Okay.
So looking back over the last couple of years, there are a number of things that I think we should be immensely proud of and make sure that we carry forward in the way that we work in the future. And the first one of those for me is our tremendous communities and how amazing they have been in terms of supporting each other, and how the community right from the beginning stepped forward, whether it was providing meals or befriending for people who felt isolated, or making sure that people had medicine or their dogs were walked. Just amazing activity coming from the community. And a lot of the success we've had in terms of vaccine uptake, for example, have been because we've worked very closely with the communities. So that's absolutely something we'll be doing, particularly in public health as we move forward, working with, listening to, engaging with our communities in a whole new way. I think the other thing that I've learned over the last couple of years is how we can work together as a system when we all have a really clear common purpose. And it's been absolutely brilliant to be working so closely between some of the services in the council and the health service in a way that we've never worked before, and really being able to use all of our resources to deliver something, you know, pretty amazing at very short notice sometimes. And that sort of joint working, I think, is something that we will take forward and learn from. And we can't go back to working, you know, in isolation before, because we've seen the success of working together.
Thank you, Lucy. A really important question from George. Ben, I'll stop spotlighting. Jonathan, did you want to come in on that? And I'll spotlight for you.
Thanks, George. Thank you for the question. We're at a milestone. We're not at the end of the journey. If we're looking back over what we've covered so far, I think the things that stand out for me, of course, are first of all the enormous amount of loss that many people in Nottinghamshire have experienced, and that will be still at the front of minds and weighing heavily on many people's hearts at this point. The other thing I think we note is the extent to which that burden of loss, experienced in so many different ways, has fallen disproportionately on our least advantaged communities. That isn't really a new lesson, because we see that played out time and time again in many different ways. But if we're thinking about the future and what we can carry forward, it is surely that in moving on from this milestone and in thinking about what we want to put in place and move towards in the future, it must be arrangements across society that are fairer and carve out a fairer deal for our least advantaged communities, so that when crises like this do occur and arise, they don't find themselves disproportionately impacted in the way that they have been over the last couple of years.
Thank you, Jonathan. Amanda, would you like to come in and to offer your thoughts to George on lessons over the last 2 years?
Yes, well, thank you. So I think the way that we have all come together across the NHS with public sector partners, other partners, volunteers, has been absolutely phenomenal. And we must take that into the next phases of the pandemic and the way that we work more generally as well. We have learnt very quickly by working together. We've put things into practice in a really agile way. We tripled our intensive care capacity almost overnight. The PPE availability, that stepped up hugely. We've had new treatments, and that has helped very much with the survival rates as well. The vaccine's tremendous, and the technology that has been brought to bear to help do work virtually and keep people safe. So tremendous progress, developments in very rapid space of time in the last 2 years. And we need to keep the best of that as we move into the next phase, retain what has worked well, and but also as has become unfortunately very clear, there are stark inequalities, and we do have to address those differently as we go forward as a health service and as partners with other parts of the public sector. Thank you.
Thank you, Amanda. George, thank you for that opportunity just to give our thoughts on the past few years. Did you have a follow-up question, George?
Thank you. Those are great responses. So thank you. I'll just keep this last one brief because I'm conscious of time. But it was just a quick kind of from all three of you. Obviously, you've talked about the importance of communities and people. What is that kind of, I guess, whether it's a thank you message or whatever it is to those people that have been so integral in what's happened over the last couple of years? I mean, what do you say to the people across Nottingham and Nottinghamshire as a result?
Thanks, George. Who would like to go first? And I'll do the spotlighting.
I can.
Okay. Thanks, Lucy.
I'd like to thank our communities, whether it's about people have followed the guidance, whether it's that people have been kind and taking care of their neighbours, whether it's that people have volunteered in making food or visiting people or participating in the vaccine centres. You know, the volunteers at the vaccine centres have been so amazingly important in the running of the vaccine uptake. I'd just like to thank everybody for the sacrifices, for the kindness that they've shown over the last 2 years, because that's the thing that's made the difference. It's not the rules, it's the way that people have responded and reacted to that. And so our communities have been amazing.
Thank you, Lucy. Jonathan, did you want to come in on that?
Yeah, I'll come in a similar theme, if I may. George, I think across Nottinghamshire there are examples of kindness and courage and service, some of which have been very prominent, and from time to time those have caught the public eye and have been profiled. But I want to thank, in addition to those people, the thousands of people who quietly and in a hidden way have got on with caring for those around them, protecting people in their communities, looking out for one another. And as we head from this milestone into the next phase of the pandemic, it's that which gives me a real sense of optimism and hope that whatever the future throws up, whatever new variant comes along, we've got within our communities the kind of the character and the leadership of people quietly getting on and caring and coping and protecting. And that gives me a sense of hope and encouragement for the period ahead.
Thank you, Jonathan. Amanda, would you like to offer some thoughts on that?
Thank you. Yeah, I would like to thank everyone for adjusting how you have lived your lives in order to protect yourselves and those around you. I would like to thank everybody for coming forward to help, whether it was a neighbour at a vaccination centre, but helping in small and immeasurably effective ways, very kind ways as well. And I'd like to thank everybody for coming forward for your vaccines, because that has been the single most important thing you can do to protect yourselves and others, and to help us get back to a new way of normal. Thank you.
Thank you, Amanda. George, thank you for the question.
Thanks.
I can't see any more hands up. Is there anyone else here who would like to ask a question before we finish? Do shout up now. It might be that we've covered everything. Oh, Ross.
Yeah, I don't know whether I'll be able to ask this question anyway. Just want to say thank you very much for having me along today. a university student from Nottingham Trent. Obviously, Amanda, you mentioned earlier on about a spring booster programme that's been going out in Nottinghamshire, but this is an open question, and I guess it comes back to the JCVI recommendation, but do you believe there will be an annual booster programme like there was for flu?
So we will wait for the guidance, the national guidance, and all of the science will be worked through, all the data about coronavirus, but we will be ready to do that if that's what's required. We are planning on the basis that that may well happen, and so if we are recommended to do that, that we will be ready to do that and make sure that we can protect as many people as possible.
Thank you, Amanda.
Thank you very
Ross,
much.
do you have a follow-up question, or has everything been covered for you today?
No, everything's been covered for me today, so I just want to say thank you very much. So
No problem. The questions. I'll just take this opportunity to thank Lucy, Jonathan, and Amanda, as always, for your time in being here, not only today, but also in these briefings over the last 18 months. And thank you to media colleagues, again, for helping to keep the public informed about COVID-19. Thank you, everybody.
Can I just say as well, I'm sure I speak on behalf of all the journalists present when I say thank you for your time, all of you, in these briefings. It's been really valuable and really helpful, very much appreciated. But nonetheless, I hope we don't have to have another one.
Yeah, thank you, Hugh. Yeah.
Thanks, Hugh.
Thanks, everyone.
Take care,
colleagues. Thank you.
Bye.